Hi guys, today's topic is pneumonia. This is a topic requested by one of my followers. So you guys can also request the topics. Please let me know in the comment section. Let's begin with it. So etiology of pneumonia, there are different organisms. First we'll go with ventilator associated pneumonia. It can be of two types, non-MDR and MDR. If the patient is having non-MDR ventilator associated pneumonia, then the causative organism remains pneumococcus. But if he is having MDR ventilator associated pneumonia, then the patient is supposed to be infected with Pseudomonas more than Acinetobacter. In case of community-acquired pneumonia, patient can have pneumococcus, Haemophilus influenzae. In case of ICU, again the patient is infected with pneumococcus. In AIDS, if the patient is having CD4 count less than 200, then the supposed organism is Pneumocystis jirovecii. If it is more than 200, then again pneumococcus. Atypical pneumonia is caused by Mycoplasma, Chlamydia, Legionella, and other influenza-causing organisms. Some keywords that can be mentioned in the questions: if the patient is alcoholic and is having lobar pneumonia, then the causative organism becomes pneumococcus. If he is having red currant jelly sputum, then Klebsiella. If he is having drug overdose, then generally anaerobic organisms are responsible. For COPD or smoking, the organism becomes Haemophilus influenzae. In structural lung disease, it becomes Pseudomonas and Burkholderia. If the patient is in contact with birds, then generally it is Chlamydia psittaci. Then in bats, it is Histoplasma. If the patient comes in contact with rabbits, Francisella. If the patient comes in contact with goats or sheep, then it is Coxiella. In hotel or cruise, the patient generally is infected with Legionella. My question number 1 for you guys is, what is the organism that I missed in case of community acquired pneumonia? My question number 2 is, what is the other name of Klebsiella? And my question number 3 is, what is the curve 65 score components? Question 4 is, how is it calculated? And question 5 is, how is it used? Moving on to the treatment, if the patient does not have any comorbidities or he has not taken antibiotics in the last 3 months, then we treat him with macrolides or doxycycline. If the patient has received a treatment or has comorbidities, then we treat him with macrolides and beta-lactam, or we can use moxifloxacin. If the patient is in IPD, we use IV beta-lactams and IV macrolides. If the patient is having ventilator-associated pneumonia, then the general treatment remains piperacillin with tazobactam. But if he is also suffering from MDR TB, then we add amikacin to the treatment. Okay, that's it for today, guys. Thank you so much. Please try answering the question in the comment section.